I want to talk about how the degradation of the microbiome or dysbiosis is related to the contraction of aggressive COVID.
The gut microbes, the organisms that live in our gastrointestinal tract, they have shown to have really far-reaching effect. This is telling us the microbes can affect not only our psychological issues, our cardiovascular issues, basically our overall wellness.
Welcome to Commune. We are on a mission to inspire, heal, pass down wisdom, and bring the world closer together. This is the Commune Podcast, where each week we explore the ideas and practices that help us live this healthy, connected, and purpose-filled life. So I'll set it up this way. We know that COVID infection resulting in hospitalization and in some cases fatality is highly correlated with people who have multiple comorbidities, right? So
yes,
pre-existing lung problems, diabetes, obesity, coronary artery disease, and weakened immune systems in general. And of course, I'm no doctor. I'm just a lowly podcast host.
Not at all, not at all.
But when I ponder this, I land on a chain of causal events that I want to present to you for analysis.
Okay.
So aggressive COVID that results in hospitalization and sometimes death is correlated with chronic disease, as I think we agree. And this chronic disease often arises from metabolic syndrome, due in great measure to chronic inflammation in the system.
Yes.
And we know that chronic inflammation emerges from leaky gut, intestinal permeability, and dysbiosis. And of course, this imbalance in our microbes is caused by myriad environmental factors, diet, and even stress.
Yes.
So I wonder if you are making this same connection.
Absolutely. You know, what you said to start with is very, very critical, that when people have comorbidities, and you mentioned a lot of them, you really become susceptible or predisposed to infections. And this is the same is true with COVID, because when you are healthy, a lot of the time you are able to fight these diseases, infection, or at least you will have lower chances of getting them. However, when we have an extreme immunocompromised situation, our immune body is not well equipped to fight these infections. Guess what happened? We are easily infected with them and suffer with them. Okay, so when you think about it with COVID, we hear a lot about respiratory syndrome. Like a lot of people have issues with the lungs. And that's why they need oxygenation. They put them into hospitals and try to make sure they have enough oxygen. At the same time, what we need to remember, in addition to the respiratory syndromes, we have also gastrointestinal symptoms. In other words, we start to have some issues with our gut. And this really have been shown to occur in COVID patients as well. Okay.
Yeah. I mean, oftentimes what we're seeing is ARDS, acute respiratory distress syndrome, or in some cases, what's known as these cytokine storms.
Yes.
And it seems as though an agitated immune system that suffers from chronic inflammation might overreact in some ways to the presence of a virus and create these cytokine storms. And it seems like certain cytokine storms trigger cell death. And in this case, they degrade the tissue of the lungs, and then the lungs fill with fluid, causing pneumonia and starving the blood of oxygen. And then we're seeing, many of these fatalities. But I wonder if you, for the sake of my audience, because my audience is very health conscious and they're pretty literate about things to do with their physiology, but the microbiome is so complicated and it has so much jargon associated with it. So I wonder if we could step all the way back. And I wonder if you could give us just some definitional help around what is the microbiome and what role that it plays vis-a-vis the immune system.
That's really great start, because it's not only your individuals or normal people, even experts, clinicians, they don't know much about the microbiome. So let me try to make it simpler, okay? In fact, just to tell you a side story, I am writing a paper called Demystifying the Microbiome. So that so that people can understand. So what is the microbiome? If you think about it, germs or microbes live on and in our body. On, what we mean by the skin. We have a lot of germs on our hands, and that's why when you go to the bathroom, you need to wash your hands and this sort of thing. But also in our gut, in our mouth, in our vaginal system, guess what? We also have that issue, okay? So there are organisms that live on and in our body. And when I talk about organism, what do we mean? A lot of people think of only bacteria as the organism that live in and on our body. But in fact, we have different communities of organisms. It's like a group of different bugs. They live inside us, okay? It's such as, in addition to bacteria, you have viruses, you have fungus, you have parasites, all of these as if they are living in a city, which let's call our gut a city. They are all living there and they interact together, okay? So the microbiome then is the total microbes that live on in our body with different communities that can play together to our benefit, or they could harm us as well. So I hope this clarifies it.
Yes, that's excellent. And I love the way that you frame it, is that we're living in a community, and a community needs to understand how to cooperate. And when social cohesion breaks down, you can have obviously dysbiosis or a disorientation imbalance in your gut, but you can also see this imbalance happening in society. And it is amazing how often the macro can be reflective of the micro, right?
That's absolutely true. That's why when I try to talk to people, I tell them, listen, these microbes, when they live in our body, it's like kids playing in a sandbox. When these kids are all getting along together, we are all very happy. The parents, they enjoy themselves, they let them play. And however, if you come and bring one bully who start to disrupt this, guess what? Everybody is unhappy. The kids are fighting and this sort of thing. So what we want to do with our microbes, we want them to play nice, okay? And that's what the secret.
Yeah, kick Candida out of the sandbox. We don't want him in there. So now we've established that there is this galaxy or this community of fungi and the virome and bacteria and archaea in our guts. Can you outline what systems are governed and mediated by this community?
This is really very, very good question, because the more we learn, the more research is published, we are starting to see that the community, especially a lot of the studies which are about the gut microbes, the organisms that live in our gastrointestinal tract, they have shown to have really far-reaching effect. And this is explained in a couple of ways. One is the gut-brain axis. It's like the brain is talking to our gut, but that's what we always thought. But now we know that our gut, through the microbes, talk to our brain. So it is bi-directional communication. And that's why microbes could affect different psychological, our mood, our anxiety, our depression. Now, that's one part of the story. The other part of the story, which we don't think about sometimes, is when you have microbes in our gut which are out of balance, which we call, as you know, dysbiosis, we also have effect on the microbes living on our skin, what we call gut-skin axis. And actually, I published a paper on that where it's very interesting. You find when somebody takes an antibiotic, which is broad-spectrum antibiotic, in other words, this antibiotic kills different types of microbes. It's not targeting some. It kills the good and the bad. In this case, exactly. In this case, what happens, you will start to have not only, even though you take the antibiotic orally by a tablet, you find that the microbes in your skin are also affected. You see, this telling us the microbes can affect not only our psychological issues, our cardiovascular issues, but also skin, and basically our overall wellness is linked to the microbiome, as these studies are showing.
Yeah, I think it's really important to underscore this idea that people are becoming more aware of the microbiome in our guts, but they're also microbiome, as you say, on our skin, in our nostrils, in the mucosa, in our mouth, on our scalp. And I've even seen theories around that there's a microbiome kind of aura around us. And even though, of course, you know, just in the creation of fermented foods, like, for example, sauerkraut, we make sauerkraut here at home in a crock. And really, that cabbage is taking lactobacillus out of the air, right?
Yes.
In its fermentation process. And then eventually the acid kind of stabilizes, and I think it creates mostly Lactobacillus plantarum. But so it's here, it's all around us all the time, which is just because we can't see it doesn't mean it's not there.
Yes.
So one thing that I've been really curious about is the immune system and microbiome. And, you know, I read a statistic that 70 or 80% of the immune system is in our guts. And of course, that makes sense because we have this long tube,
yes.
You know, from our mouth to our anus and everything in between. And this is the part of us that is most in contact with potential toxins and pathogens, in this immune system is fine-tuning with everything that we put in our body. So I wonder if you could just take a moment to talk about that relationship between our gut bacteria and the immune system and how they play together.
Yes, definitely. So if you think about it, remember the first definition we want to have in our gut, we have the beneficial microbes, but also we have the pathogenic microbes. So when the beneficial microbes are really surviving very well, they are happy, what they do, they secrete certain, what you call short chain fatty acids, certain metabolites, which is small compounds. And these short chain fatty acids, and the one which is very famous, or a lot of people talk about, is butyrate, butyric acid. This sends a message to our, brain, our immune system, and improve it. The other thing, these microbes which are beneficial, like Fecalibacterium, for example, they are known to be anti-inflammatory, which means they encourage the secretion of the cytokines, but they are anti-inflammatory cytokines. Okay? Now, the flip side, if we have the pathogens there, like E. coli, Clostridium, and this sort of thing, guess what happened? They secrete what we call pro-inflammatory cytokines, things that really will agitate our inflammatory system and our immune system. That's why it's this balance. We need to have organisms, and by eating certain type of food that are more anti-inflammatory, or they produce cytokines that are our bodies, rather than having those bugs, which a lot of the time we feed them with eating too much high fat, the Western diet in general, because these are gonna produce what we call pro-inflammatory and make our immune system worse.
Yes, exactly. And I want to get into eventually some of the things that we can feed ourselves to bolster our immune system and general gut eubiosis. But before we get into the good news, let's I want to probe a little bit more around what toxic bacteria there are in the gut, and what are some of the other inputs that create dysbiosis, and then and in connection with that, intestinal permeability or leaky gut, which can lead to inflammation. So maybe you could spend a few minutes talking about what creates intestinal permeability and why that's so dangerous for our homeostasis.
This intestinal permeability, remember, we have, as you described, from the mouth down to anus, we have all this tube or intestine and whatever, which should really be confining. In what way? We only need the nutrients to go through. We don't want the toxins to go through. So what happens when you have pathogenic bacteria, they produce lipopolysaccharides or LPS, which are toxins. And of course, right, some fungi, they secrete mycotoxins, for example, okay? And these, what they do, let's not talk about, okay, they produce them, but if our intestinal lining is intact, it's like you have very nice plumbing in the house, no leakage will happen. However, when you have some pathogens, which the first what they do, you can imagine, they stick to our gut lining, and then they start forming what we call a biofilm. It's like the plaque in our teeth. And when you do that, they'll start poking holes in between our cells. And that's why they sort of, instead of being a nice tube which does not allow except the good stuff, the nutrients to go through, it will start this what we call leaky gut, as you say. Then we have all the LPS, the toxins, some food which should not go through there, and that's where the situation become really much worse, and that's where we have leaky gut, which is directly connected to, of course, inflammation and various types of diseases. Sorry, go ahead.
No, go ahead. Sorry. No.
Like a lot of the time when I first were looking at leaky gut, when I used to do studies with Candida and HIV infected patients with AIDS, because of their immunity is down. A lot of the time we have leaky gut there, and that's why they have so many health issues, because of the leakage and because everything can pass through. So what we need to do is we need to make sure we maintain the gut lining so that we avoid having the leaky gut.
Yeah, and I'm not sure if this is an engineering flaw per se. It's hard to. I don't believe nature ever makes mistakes, but this lining, this epithelial wall, is so thin, right? It's like 6 microns thick or something like that, yes. And so it does seem very susceptible to puncture. And I've read about a lot of different potential inputs that degrade either the epithelial wall or separate the tight junctions that form this wall. And I wonder if you have thoughts about like the taking too many NSAIDs or PPIs or other kinds of foods that might degrade this wall or cause permeability. What are some of those inputs in your opinion?
Absolutely. I mean, medications is one of the main reasons sometimes we have effect on the microbiome. It's very interesting relationship between the microbiome and the drugs we use, the medications and therapies. It could be a good, but it could be bad as well. Okay. So if we look at it, when I gave you the best example before about antibiotics, because everybody understands that but in addition, non-steroidal anti-inflammatory, all of these efflux pump stuff, all of these can cause imbalance in our microbiome, and studies have been shown to do that. So once you have this imbalance, you are encouraging two things. Number one, you are decreasing the diversity of the microbes. What do I mean by that? That it's like our society. the more diverse the society, from my point of view at least, the better.
That's right. Just the pressures of environmental pressures of selection there, you would imagine that would produce greater, better results, right?
Exactly. And that's the same in our gut. The more diverse we have, the better. But when we start taking these medications and they affect some of these communities which are good, we start having the pathogen or those that can cause disease increase. And then the diversity become low. And of course, remember, when the pathogen increase, they have a tendency to, you know what? Nobody is keeping me under control. I want to attack. And so they go stick to the gut lining. And as we mentioned before, they form biofilm. They start breaking the gut lining and cause an infection. I'm going to give you an example, which I know you would love with respect to Candida. Okay. Candida, it is known as an opportunistic pathogen. When I did a study before, maybe 70-80% of us have Candida normally there. Okay. So when you change this balance, Candida will overgrow. And particularly with the lactobacillus, if we call the lactobacillus, because lactobacillus is the good policeman that keep Candida under control. So when you get rid of it, guess what happened? Candida overgrow and start to cause problem. Okay. Now, not only this, Candida is smart. Once it overgrows, they say, oh, this lactobacillus keep me under control. Guess what I'm going to do? I'm going to inhibit it. They start to keep it down. You see? So it's very, very interesting dynamics between these things.
Yeah. So you've described how the gut wall becomes leaky and how it then toxins and lipopolysaccharides leave the intestinal tract and get into the bloodstream, which then triggers an inflammatory response. But of course, many of us were raised thinking that inflammation was a good thing. Like we would, be playing basketball and sprain our ankle, and then it would trigger an inflammatory response, and white blood cells would rush to it and eventually engage in a healing process. But can you explain to us the nature of inflammation and perhaps the difference between the acute inflammation that I just described and chronic inflammation?
When you think about it, inflammation is a good thing if it is kept under control and we don't go into the cytokine storms that we see in COVID. Okay. Why? Inflammation is the response of our body to foreign objects, particularly germs. So if the germs come, our bodies start to produce, various immune cells, various byproducts, to keep this microbes outside, and so that we are healthy. Okay, so that's one thing. Now, the other case is when we cannot control this, and then inflammation goes haywire. And by the way, when it goes haywire, it starts to destroy the host cells. The human cells are destroyed, which is really, we don't want that. Okay, so that's why it's very important sometimes to try to take, for example, cruciferous vegetables, because they have some anti-inflammatory activity. So we need to keep inflammation under control. We need it, but you don't want it to go haywire, as I mentioned.
Yeah, and it seems increasingly people, doctors and studies are making the direct connection between this chronic inflammation and many of these cresting autoimmune diseases that you just referenced, like rheumatoid arthritis or psoriasis. Or IBS, et cetera. And then also very dangerous chronic diseases, some of the main killers, right?
Yes.
Heart disease and cancer and diabetes. So can you play with that for a moment? What is this relationship between chronic disease and inflammation? What's happening there?
I think when we look, as you said, we looked at cancer, for example, in the oral tongue cancer, and we published that. Okay, usually what we found, in addition to having imbalance in both bacteria and fungi, we start to see also there are some metabolites which these organisms secrete, which also our body react to. Okay, and they become really more tumorogenic, which means induced tumor formation. Okay, now, and the chronic situation could be with us based on our lifestyle as well as what we eat. If you continue eating food which does not really induce anti-inflammatory results, you are gonna aggravate this, and you will start to have a chronic inflammation, which manifests itself a lot of the time with the gastrointestinal like symptoms, like Crohn's disease, for example. Crohn's disease, we looked into it and we found that, we actually just about to publish a paper where we looked at some probiotics, and we found that they start to have these MIP cytokines increased, and the same, we found that organisms such as protobacteria, when it is secreted or when it is abundant, it starts to cause also effect on chronic inflammation in the gut. Okay, and we did those studies in mice, and that's why we try to say, okay, we have this chronic inflammation, how to take care of it. And one of the reasons we found that people who take a lot of sweeteners, for example, these artificial sweeteners, they have high levels of these protobacteria. So it's really what you are exposing your body to and how your body react to it over a long period. It does not have to be acute where we have, really serious infection, for example. It could be chronic, lasting for a long time, which you are probing it and causing it to stay with you, instead of trying to change your ways and try to reduce that, hopefully,
Yeah, I was reading just a fascinating paper about this one particular bacteria called Akkermansia, I believe is the pronunciation.
Yes.
And its relationship to cancer. And of course, you're the doctor in the room, so I'll need some help here. But, the body is developing these kind of isolated cancer cells on a regular basis, and the immune system can actually destroy cancer cells when they don't metastasize or grow. But oftentimes cancer, when it's pernicious, it cloaks itself biochemically and goes through a process of angiogenesis and then begins to spread. And there's this new, relatively recent treatment using checkpoint inhibitors that can actually remove that cloak and let the immune system actually do its job. But if your immune system is degraded, it won't do its job. But the presence of this good bacteria, Akkermansia, seems to be able to enable the immune system to kill cancer on its own. It's amazing, right?
Yes. Yeah. I remember Akkermansia really a lot of the times, like the vast majority of publication shows that it is a good organism. It's a beneficial one. And in fact, some people are trying to look, can we develop Akkermansia as a probiotic, because of these benefits you mentioned. Okay. Yeah. Now, you mentioned checkpoint inhibitors, which brings another really wrinkle to the microbiome. Studies have shown that 30% of patients, they fail checkpoint inhibitors. In spite of the fact they are fantastic, they are really new innovation. And you know what they found? They found that some microbiome members that live in our gut break down the checkpoint inhibitors. And when they break them down, guess what? They become, the patient will not respond, will not be cured, okay? Mm-hmm. So what we did, I'm working with a group, Dr. Ted Technos who is the head Seidman Cancer Center, and Quentin Pan, who is also a professor at Case Western Reserve University and University Hospital of Cleveland. And what we did recently is very interesting. They have two mouse models, okay? One mouse model that responds to checkpoint inhibitors and the other that does not respond. and they have different inflammatory pattern. But from my point of view as a microbiome guy, I said, listen, let me look at, is there a difference in their microbiome? And lo and behold, we found that there is differences in the makeup of the gut of mice that responded versus the others. And now, as you can imagine, I would love to continue collaboration so that we look into really the microbiome and this is very hot air, especially with checkpoint inhibitors. So I have a number of colleagues. We are trying to crack this nut, but we'll see what happens.
Yeah, I mean, this is the forefront of science, and it's so exciting. Please, well, this will be a great continuation someday as you get more data here, because I'm very interested to see what your findings are with regards to how those different cultures of microbiota between the two mouse groups, because I think that there's a lot of interesting information there.
Sorry, I want to tell you also another wrinkle which could be interesting. In addition, as you can imagine, because I worked with fungus all my life, like over 40 years, so you can call me a fungi from that point of view. We also looked at both bacteria and fungus communities, and we found differences in them. So it's really exciting, because I love to see how these organisms interact together. So yes, I hope once we do more studies, I would love to talk with you about them.
Great. Well, let's talk a little bit about COVID-19 and depression. And I was looking at some statistics, and when COVID onset in March and April of 2020, there was just an efflorescence in the prescriptions of anti-anxiety medications, in antidepressants and anti-insomnia drugs. And obviously, we can trace this back to a tremendous amount of fear and uncertainty. We can connect that to the overconsumption of alcohol in certain cases, and this stress and fear and alcohol abuse has direct connection with your gut and your microbiome. And so can you help us connect those dots?
Oh, no doubt about it. I mean, this is really, you put your finger on the pulse here. So you can imagine, if we think about how we lived with COVID, okay? And it is well known, you gave the statistics, like 60% of people, they really are saying they have mental health issue with this COVID, okay? And the number of calls to help centers increased by nearly 900%. So this is real issue, okay? Now, when you look at, okay, what is causing this? There are multiple factors, and you mentioned them. And let's look at the lifestyles, because that's really what you talked about. One of them is an Italian study, one of them is sleep, okay? An Italian study showed that because of the COVID lockdown, okay, there was an increase in depression, anxiety, and sleep disturbance. For example, 23% in that study reported depression, and more than 40% reported sleep disturbance. And you can imagine there is very good relationship between sleep and the microbiome. It's similar to the gut-brain axis. It is bidirectional. Sleep affects the microbiome, and microbiome affects your sleep, okay? So let's look at the scenario when we have really good sound sleep, okay? Sleep efficiency and total sleep time, if you measure by this factor. And what you find that having this good sound sleep really support the microbiome balance and diversity. And we talk about diversity. So we have good guys living there, and also they are diverse. And also what they found out, that this positive effect of the microbiome on sleep is due to the fact that, remember, I mentioned secretion of butyric acid or butyrate. They showed that, which is, for example, gamma amino butyric acid. It's a new transmitter, as you know, neurotransmitter that's known to promote sleep. So this shows you sleep well, you are going to be in a good shape. Now, what happens when we have lack of sleep or sleep fragmentation? You have repetitive short interruption of sleep. You wake a lot of the time. This affects directly the diversity of the microbes, and guess what? It decreases. Also, that's really the most important thing. So having organisms that can produce the butyric acid, having better diversity is going to help you. And that's why I recommend, look, one of the ways to deal with this depression is you really need to have at least 7 to 8 hours. Okay. So that's one factor. So the second factor, which we looked at, is what you said, stress. And stress, it is not surprising that there is a relation between stress and the microbiome. In fact, more than 40 years, people did studies, in animals, and they showed that stress can alter the gut microbiome. Okay, at that time they looked at the bacteria. Okay, now, so let's look at how stress may affect us. It has really many effects. Number one, if you are really having stress, you are starting to see an increase in the secretion of inflammatory cytokines, which we talked about. Remember, so if you have inflammatory cytokine, like for example, interleukin 6, this is gonna really regulate the inflammation, as you know, making it worse. Also, it affects exactly what you asked me before, the gut barrier, intestinal barrier. Okay, yeah. Where it allows all these toxins, which we mentioned, LPS, mycotoxin, other food which shouldn't be there. So leading to leaky gut. Okay. However, in response to how this happens, sort of the mechanism a little bit to talk about. In response to stress, the hypothalamus pituitary adrenal axis produce cortisol. And as you know, cortisol is our body's built-in alarm system. It tells you, okay, fight or flight. And of course, because of this, I remember like when I get sometimes into, thank God that doesn't happen often, but in one period of my life, I was really under stress. You find your body becomes so fine-tuned, your vision become better. So, but the problem when you finish that stage, then you have crash down. So that's most probably due to cortisol, okay? Which really leads to a number of neurological issues, including depression, okay? And so this is the second factor which plays an important role in depression and its relation to the microbiome is the exercise. Now, we are talking about COVID, so guess what? We are all locked down. Our physical activity has really gone down. Okay, 70% of people in a study reported decrease in their physical activity. And because of this, what are we doing? If you think about it now, how many Zoom calls do we have? The kids are all sitting at home playing games instead of going out. We are on the phone all the time. So we definitely have a reduction of physical activity. And as you know, exercise is well known to be associated with benefits. When you exercise, I exercise in the morning now. I wake up every morning, I exercise. And honestly, if I don't do it, the whole day does not seem the same, but you feel good after you finish after exercise, because in a way also studies have shown that this exercise affects the microbiome directly or indirectly. And our favorite subject, of course, is increase the diversity of the microbes, okay? When you exercise, you have increased diversity, and we already established that this is a good thing. Also, it controls the balance between the beneficial microbes and the pathogenic one, okay? So now, if we have also exercise, that's the other thing which makes us feel happy, We know that our body start to what you call secrete dopamine. Okay, our brain secrete dopamine, and as you know, this is a feel-good endorphin. Also serotonin, which is, by the way, 95% is produced in the gut.
That's amazing, right? I mean, nobody associates serotonin, this kind of feel-good hormone, with your gut. Everybody thinks it's completely just neurologically developed in the brain.
Yes.
So it's fascinating. Yeah.
Yeah. So that's why I really think with this serotonin, as you say, feel good, make you happy, these are really a lot of advantage for exercise. Also, the inflammation, as you can imagine, goes down. And by going that, we will be in a better, more better mood, less depression, And finally, as you can see, there is some subjects keep coming. Okay, diversity, leaky gut, it's all related. Basically, a common mechanism for these issues. Okay, and if we don't exercise very well, okay, what will have significant disruption of the gut microbiome. We have the imbalance. We also have this imbalance, as you can imagine, lead to neuropsychiatric issues, or disorders, including depression. So these are the main lifestyles, really, components that could affect our depression.
Fascinating. That's just amazing. And I think that you do such a good job at elucidating how this is a two-way street, right?
Yes,
that we have, for example, we might watch something on the news that could stress us out. Imagine that in this day and age, right?
Yeah.
And this puts us in a state of amygdala hijack or sympathetic overload, which in the amygdala, which kind of in its relationship through the hypothalamus and the endocrine system releases cortisol. Cortisol is contributing to this disorientation or dysbiosis in the gut. And subsequently, there's all of these domino impacts or effects to that, which include inflammation and chronic disease and negative cytokine development. So, I think it's so important for people. People need to be concerned about public health and what's going on in the world. But at least what I've applied to my own life is try to read a little bit more. Don't be absolutely consumed by the 24-hour news cycle, because that whole media cycle is built around a business model of agitation, of leveraging human negativity bias to put us in this place of, outrage and fear that then has all of these really negative neurotransmitter-oriented downstream impacts. And then at the same time, you can do things within your own control that, for example, stimulate the regulation of oxytocin. Like I was reading about Lactobacillus reuteri.
Yes,
right?
Yes.
Which is upregulator of oxytocin. So, a lot of this, people have a lot more control than they think they do.
I really love what you are saying. I tell you why. About the news. I lived in England for many years, and I used to watch BBC News. BBC News, it was at 6 o'clock for 15 minutes or 9 o'clock at 15 minutes. And guess what? You will know what's happening in the world in 15 minutes. So much so that when I was at the American University of Beirut as a student, my English teacher gave us an assignment. He says, you need to write something and then come talk to the class about it, but you have to tell the story in 5 minutes. And you know what he said? Because BBC tells you all the stories in the world in 15 minutes. So to me, honestly, to me, you are absolutely right. I used to listen to NPR and other. Now I put, believe it or not, in my way to work, I put classical music. I don't want to listen to news because, as you say, these newscasters, they don't tell you the good news. Always they want to tell you the bad news, you know? So, yeah.
Well, it's also they don't have the time to tell you the full, complicated, nuanced background of a particular issue or situation. This is honestly why I love podcasts, because it's this long form information. And to be honest, I listen to you quite a bit, and I'm much less fearful because I'm grounded in rigorous, informed data. And that takes the edge off fear and outrage and hyperbole and scandal and ostentatiousness. And so, you know, I would just really urge people, if they want to know more about the microbiome, then listen to the Microbiome podcast, or there's many other, you know, great doctors. I listen to Dr. B, or, you know, sometimes Mark Hyman or Dr. William Lee, obviously yourself. And, you know, you can be really grounded in some well-rounded knowledge that really takes the cortisol edge off and allows you to move into your prefrontal cortex and apply some reason and rationality to deciphering some of these complicated issues.
I really agree with you. And, you know, to really tell you, I am an optimistic person. And I tell people, listen, I know it's hard time. I know it's really something which we did. Like, I am 71 years old. I have not seen something like this now. But I am an optimistic person. And I believe we are going to get over it. Let's follow the science. Let's think about stuff. Let's do the rational things. And as you said, go out for a walk. Go out for a hike. I love, one of the best times of the day for me is I have a dog called Prince. I take him now when I go home for a walk. Oh my God, I love it, because we are very fortunate. You know, we live in a great country. It's beautiful. And you just go enjoy yourself. Don't think about things. Try to meditate. I tell people sometimes, you know, I come from the Middle East, you know, I never thought of yoga, you know, even though like in India it's so famous and this sort of thing, but not as much in the Middle East. And guess what? I started to do some yoga before, you know, this COVID, and 1.5 hours in Sunday, guess what? It really relaxes you because it takes your mind of all this input. So that's what I would love people to do, because we are going to be fine.
Well, I just want to ask you one more question, because you mentioned short chain fatty acids. There are three, I guess you might call them famous ones: butyrate, acetate, and propionate. And they regulate and mediate so much, from mood to cardiovascular functionality and pulmonary activity. You know, they can have so much influence on your systems, but they are a byproduct of your healthful microbiome.
Exactly.
And they are produced when that microbiome is well fed.
Yes.
And, you know, we eat as humans, and our small intestine absorbs a lot of food, and what it doesn't digest, the food moves into the colon. And guess what? That's the main course for our bacteria. So what should we be feeding them such that they can produce these metabolites that seem to have so many good effects?
You know, the short answer to this is we need to feed them fibers, okay? In other words, what fibers? There are a lot of food that has fibers. And sometimes they call it resistant starch, you know? And this includes, you know, oatmeal. You can have rice. You can have multigrain, sprouted grain. All of these, like legumes, different types of beans. This really is very, very important. In addition to that, what I recommend that we should have good quality protein. If we can have plant protein, will be great, okay? But if you like fish, I love fish, you know, because especially salmon and this sort of thing, they have very good, you know, omega-3 fatty acids, for example. So what you need to do is you need to feed these food, these, like the directly one is the fiber. Fiber is a great thing to have. But in addition, we need to give them cruciferous food, because in addition to feeding your good guys, you are helping your inflammatory status. So if people start to eat more of whole grain, less, more, like for example, low sugar. Low sugar is critical. You know, I come from Lebanon, and we have orange there, and I love orange juice. But now I really look very closely at the orange juice that are sold, and there's so much sugar in it. So low sugar is not is very, very important. Especially it loves candida. So these are the types of things which I love to have. Asparagus, for example. Oh my goodness, and beetroots, celery, artichoke. All of these are good type of food that's gonna support your beneficial microbes and keep the pathogens down.
Yeah, and they're delicious. People sometimes feel like they have to make these Herculean sacrifices to have a healthy gut, but on the contrary, you can eat so many good foods that, as you say, are whole foods and fiber rich, and you're not giving anything up. In fact, you feel great, and you know, I the cruciferous vegetables for me, I love that.
Yes.
And you know, just to have snacks of pecans or pistachios and walnuts with a little bit of blackberries and blueberries on the side. I eat this coconut probiotic yogurt in the morning, which is just absolutely fantastic. It tastes better than any sweetened yogurts, you know?
Yes.
So you really don't have to give anything up at all. In fact, you're in receipt of nature's bounty.
I really agree with you. You know, it's so funny. Once you have to try, like I tell you a story. My son-in-law, he used to eat Western diet, pizzas, hamburgers, all those sort of things. And then I don't know what happened. He started to go slowly to start shifting a little bit. Now, I couldn't believe it. The guy all his life is brought up eating Western diet. Now he's a vegan. And guess what? He sleeps better. He lost weight. He feels good. You know, so to me, look, I know sometimes we go and buy these food. It's much easier to get and whatever. But once you slowly but surely move in the direction where you eat this healthy whole food, you are going to be much better. Not just you and the microbes that live within you.
I love it. Well, Dr. Ghannoum, you're such a pleasure to speak with. I mean, sleep, reduce stress, exercise, a lot of fiber, and my guess is have a lot of fun because
exactly.
and use this moment, this inflection point, as a way to improve and to connect with nature's bounty, to connect with your family, to connect with your neighbors, and we really can remake life in a better image. So I think I'm so grateful for all of the work that you're doing, and I've learned so much from you. I appreciate it.
Jeff.
And I hope we can continue this conversation as more data becomes available in this emerging field of the microbiome, because there's so much happening. Hey, thanks for watching. If you liked this interview from the Commune podcast, then I think you'll love this video right here. And if you want to get more weekly content from Commune, you can subscribe right here on our YouTube channel, or find the Commune podcast on Apple, Spotify, or wherever you get your podcasts. I'm Jeff Krasno, and I am here for you.